He always with us and always supports us, encourages us. So may I request Khalid Mahmood Khan Sahab to please open the webinar. Khalid Mahmood Khan Sahab, please.
Thank you, Dr. Dr. Shinwari. First of all, I welcome all the participants, especially Professor Yu Hang Kim, President AASSA, Dr. Fazal Ahmed Khalid, Chairman, Punjab Higher Education Commission, Dr. Fazal Hadi, Chairman, Islamabad Regulatory Authority, Health Regulatory Authority, and all the participants from around the world. I just heard from Dr. Zapta that there has been 600 registered participants in this webinar. The previous webinar, which was on the preparedness, challenges and lessons, was also a great success. This is the second seminar in this series, and I am sure that's going to be also a great success. We have to learn lessons from each other. That was the main idea of holding these series of seminars. And we must share our experiences, our knowledge, our research with each other, so that we can be well prepared to face these kind of calamities, and especially this one, which is we are facing these days. In this connection, multifarious approaches has to be multifarious, I should say, multicultural, multinational approaches have to be taken so that we can eliminate, eradicate these kind of calamities. One health is also important because it has been learned that animals also one source of spreading this pandemic. So we have to take all sides, take all sides into consideration when we are treating this pandemic. Also, I have seen in the program there are new technologies, how new technologies can be used, especially nanotechnology, which is to be taken care of, and how this technology can be used for the to stop this pandemic. Also, one important factor which Professor Zapta will be speaking about, and other speakers also, which is generally ignored, is biosafety and biosecurity. In the laboratories, especially in Pakistan, and I know in most of the developing countries, biosafety and biosecurity measures are not taken care of. Everybody knows that there have been rumors about the spread of this pandemic from Wuhan labs, but that's not proven yet. Anyhow, the laboratories which are dealing with the virology and the viruses have to be very careful and observe all the biosafety and biosecurity measures. So I think this webinar is going to be a very useful and successful in highlighting all the aspects which we must take care while dealing with these pandemics. And I again must thank the organizers, especially Dr. Zapta Shinwari Khan, Dr. Sabarayar, for organizing this excellent webinar, which will go a long way in dealing with the pandemics. I thank you and wish you all the success.
Much, His Excellency President, Pakistan Academy of Sciences. We are grateful. You always, guide us and give us strategic lines how to work. I'm pleased to announce that we have now already speakers today from China, from Sri Lanka, and from Indonesia, and several others. So this is a good day. Now I'm going to request our very dear fellow, a senior fellow of Pakistan Academy of Sciences, Professor Dr. Fazal Ahmad Khalid, who remained rector of one of the very great institute of Ghulam Ishaq Khan Institute, where now this is on a limelight globally too, and he is chairman, Sir, Punjab Higher Education Commission, as rightly said by our president. Sir, over to you.
Thank you very much, Mr. Rahman Rahim, Honorable Chief Guest and President, Pakistan Academy of Sciences, Professor Dr. Khalid M. Khan, Chairman DRAP, Dr. Fazle Hadi, Professor Kim, Professor Lee, distinguished guests, ladies and gentlemen, Assalamu alaikum and good morning. First of all, let me congratulate Professor Zabta Khan for organizing this Pakistan Academy of Sciences and AASSA joint webinar. And I think, sir, you have provided us all a platform to have a view of the event in the current situation of pandemic, and you have provided a platform not only at national level, but also invited speakers and guests from the international community. And let me say that Punjab Higher Education Commission, in collaboration with Pakistan Academy of Sciences and AASSA, would like to work, and also with DRAP, on the challenges that the world is facing, and particularly in Pakistan, where we have to see that how best we can have international collaboration, and also link with the important stakeholders, particularly the universities, and in medical sciences, and also in the modern technologies of molecular sciences to virology to nanotechnology, so that this interdisciplinary platform should provide us an opportunity to work together and share our research and see how we can have joint collaboration at this platform, where Pakistan Academy of Sciences and Apex Forum in Pakistan can lead research in the important areas which have a direct impact not only to the society in Pakistan, but also world over. And we look forward to see that whatever support is needed from Punjab Higher Education Commission, with all stakeholders, with the universities in Punjab and also in Pakistan, we'll be very happy to collaborate. And also from the technology point of view, Pakistan Engineering Council, working with all stakeholders, have contributed in coordination into the local design of ventilators. And I think there's a big potential which is available in the country from the scientists and from engineers to work with the international community for the good of humanity. So thank you so very much, and many congratulations, Dr. Zabta Khan, for inviting me, letting me have this opportunity, and providing us all a platform for collaboration and exchange of view, and see how we can deal and solve the problems, particularly in this new normal situation of pandemic. Thank you so very much.
Thank you very much, sir. We are really grateful. You've been a source of inspiration for us to have converted GIA in a very internationally known organization. In the recent QS ranking, it has got a very prominent space internationally as their work in innovation. Now, may I again, another very kind, good friend, request Professor Yu Hong Kim, the president of AASSA, kindly say a few words to take us further. Professor Yu Hong Kim.
Thank you very much, Professor Shinari. And I thank you, the officers and staff of Pakistan Academy of Science, under the leadership of Professor Khalid Mahmood Khan, President of PAS, and other distinguished guests right there, for hosting this webinar, and also for supporting this webinar. And I already talked about, I already delivered my address in the first webinar last week. So I will not elaborate on those items again here today, but I'm concerned about another future pandemics. Okay? For example, we have virus-induced pandemics in 1950s, Asian flu pandemic, and also the in 1968 Hong Kong flu pandemic. Both pandemics caused about 1 to 4 million mortalities. And not the pandemic scale, but there are several endemic scale diseases. For example, Ebola in Africa, and also the SARS, severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome. These are all the result of increased human and wildlife contact. And this increased human-wildlife contact is caused by the indiscriminate development of wooded areas, and also the rapid urbanization, and also the use of wildlife as a source of food and sometimes medicine. Okay? These anthroponic activities inevitably increase the contact between human and wildlife, and I don't have any doubt that in the near future, another pandemic or endemic or pandemic will emerge from these interactions. So I recommend you to include someone who can speak about this in the third webinar, okay? And we must actively pursue the research into these fields, viruses, and also we need some fundamental change in our preparedness against the next pandemic. Okay? For example, training of medical staff and establishing the medical institutions, and also the stockpiling of essential strategic materials. That must be done with the support of the government. Okay? So I urge the government to support active research in the virus field, and also the preparedness against the future inevitable pandemic too. Okay? So why don't you bring someone who can speak about these aspects in the next webinar? Okay? Okay, thank you very much.
Thank you very much, Professor Kim. You always, this is great. We got some new lines from your talk. And I assure you that the next speaker that I'm requesting him, he is Professor Fazal Hadi, who is the chairman of Islamabad Healthcare Regulatory Authority, and the recommendation that you are putting forward, training of the staff, looking at the security and safety of the people, etc., etc. So he knows he doesn't need any introduction. He is the chairman, board of governors of many entities in KP, and he is the Islamabad head of all the now hospitals, their quality assurances, etc., and the laboratories, any healthcare system. So may I request, without further delay, Professor Fazal Hadi Saab to kindly say a few words here, sir, please.
Thank you.
Bismillah. Professor Khalid Mahmood, President of the Pakistan Society for Science, Professor Zapta and Shinwari Sahab, the hundreds of scientists and luminaries across Asia who are in this webinar, greetings to you all. We are actually living through very, very challenging times in our lifetime. This sort of pandemic has not been faced by any of us so far on this scale. This is the worst that we have ever seen in our lifetime. We have heard of the pandemic of the 1914 to 1918, the Spanish flu, and then the vast damage that it caused. But now we are faced with something which is similar, or if not worse than that. It is important that we get together and try and combat it in a way that is best for the communities across the world. It's very important that we understand that it is not a one country disease. It is basically a pandemic. In fact, I would call it an endemic pandemic because it is existing across the world and it keeps turning around. Many people thought in the beginning, when it came last year, in fact, it started in November, December 2019, and then spread across the world over a slow period. And everybody thought that it'll go away. Well, it can't go away. It's not like a stampede that comes from one end and goes to the other end and falls into a ravine. That's not possible. It's a virus that goes round and round and round and mutates. And there are different strains over a period of time that cause a lot of damage. So this is what is happening now, and therefore the world community has to come together. But the world community has to be led by scientists like yourselves. It's very important that everything is based on evidence-based science, and therefore it is important to get to conclusions and in fora like this and advise the governments. You cannot allow just the politicians to guide us in this. This is a disease which has to be handled by scientists, epidemiologists, physicians, doctors, all together, and scientists like yourselves who will lead the world. It is also important to make sure that there is no vaccine apartheid. I think we are actually facing a problem now where the poor countries who cannot afford vaccines are being deprived. And so there is a tremendous amount of hurt that goes on. If you look at India, that's an evolving tragedy, and our hearts go out to them. This is a tremendous tragedy that is evolving right in front of our eyes. The unfortunate leadership failures have also occurred in places like Brazil, for example, and one European country which I will not name, but that also caused a tremendous amount of damage because of the epidemiologists who misread this whole situation. So I think everything has to be evidence-based, everything has to be scientific-based, and everything has to be studied properly. Now, what to do in this? I think it's the important thing is, as I said, to get together, the scientific community has to get together, raise their voices, and advise the governments across the world how to go about it. We saw in the United States that in the beginning, there were problems in terms of political control of political control over the handling of COVID-19 virus. And that caused some serious problems. But now that there has been more control by scientists and epidemiologists, it has really worked. Now, the same thing has happened all across the other parts of the world. For example, New Zealand is a great example. The same applies to places like Australia. They're being very strict, and there are some of their laws which have come into controversy. However, it is important that we must all get together. So what is to be done? Well, first of all, vaccination. That's the most important that has to be done. There is a term called herd immunity. Now, this is a mirage, unfortunately, and this is a mirage which is a mirage for the developing world. This is something that we have really got to achieve sometimes, but really important thing is to vaccinate and to make sure, number two, that the standard operating procedures for combating the virus, like distancing, social distancing, wearing masks, washing hands, and all of that is done by communities across the world and is enforced. And the third thing is that the world community of scientists must get together and try and evolve a way of bringing about some sort of antiviral drugs which can cure this thing. Because I think this has to be a combination of all this. I think that but we must remember, I think one of our speakers said earlier on, that there are bound to be more pandemics in the future as well. Human societies are evolving, human societies are actually impinging upon and traversing into nature in such a way that their nature strikes back. So please, I think we must remember that we must get together and we must evolve strategies whereby we can deal with pandemics like this in the future, just like we have been dealing with disaster management on a massive scale. The thing that it has to be done in the same way. I thank you very much, Dr. Zapta, for inviting me, and thank you for the time that you've given me. Thank you.
Thank you very much, Dr. Fazal Hadi, and we got another good, lens to see the pandemic. Today, as Professor Khalid Mahmood Khan said, I will be also touching the neglected aspect of the pandemic. So now what we are going to do is, we are lucky we have Professor Jinghua Kao also from China. Anso, he's ED, he's a great friend. And then we have our very good friend from Japan, Professor Nariyoshi Shinomi, president of the institute, a great applied kind of a scientist who knows more about it. But I have to hand over this whole next 90 minutes to our very senior fellow, a very important person, a boss of the bosses, Dr. Muhammad Ali. Let me try to have him, please unmute him. Dr. Muhammad Ali, I was praising you, hope you listened it when I said boss of the bosses. You know what I mean. Our Secretary General and myself are your employees, so you can do whatever you want to do. So thank you very much, sir, for accepting to be moderator for next 90 minutes. We will be handing it over to you. But if you allow me just to, because the first item, okay, you can invite me if you want. But let me tell you the audiences, both many of them online, from many countries, that Professor Muhammad Ali is really a young, great scientist, our fellow of the Academy. And he remained Vice Chancellor of a very, young university, and he changed it into now international ranking university, which is in the same city where a president of the Academy lives in Islamabad. He was a really pioneer Vice Chancellor there and did a lot of good work. And because of that, he was given responsibilities of Qaid-e-Azam University, which is the top university of the country, to lead us for a better future. So, Dr. Saab, we are grateful that you accepted to spend 90 minutes with us and to have all the speakers. I will be handing it over everything to you, and now you between the speakers, and you have a bunch of very good speakers from the different countries. So thank you very much, and over to Professor Dr. Muhammad Ali.